In order to maximize patient flow on the day ward and avoid losing chair time in the morning, we need to make sure that drugs are manufactured the day before the treatment is due as much as possible. So in order to achieve that, physicians should aim to physician verify 7 days prior to treatment, which allows pharmacy 6 days to make that drug up if it's cheap. And they should aim to admin OK the high-cost drugs as soon as possible, preferably 2 days before treatment. This allows for all drugs to be manufactured the day before the patient turns up. Therefore, they will be on the shelf, ready to go and hook up at 8 o'clock in the morning. In order to do that, we use the medication list filter in NCIS. You can find the medication list in several places on BDKato. It's the little clipboard in the top right-hand corner, which will always be visible no matter what screen you're on. On the home screen, you can find it here. See the clipboard again. And if you've already used it, you can switch between patients and your medication or work list simply by clicking these double arrows. We want to minimize the number of medications you have to review. In this screen, you can see that there are 68 to review. But in reality, we just want to see the red X's, which are the ones that aren't signed off for a go-ahead. And in order to do that, you can adjust your filters with a little blue down arrow circled and then refresh the list. Also, you can dramatically increase the number of medications you can see on a screen by eliminating unnecessary fields. Right-click on the title bar anywhere, say in the medication title bar, and untick or tick the fields you want to see. I have removed patient names for confidentiality purposes. You can see that we've dramatically reduced the number of medications that has to be seen by yourself, and they are all ones that haven't been signed off for treatment. You can order your columns by clicking on the arrows. Here you can see that the status is being sorted, and the aim should be to for the physician to quickly admin OK anything that says setup complete, because that means the manufacturing is in process. Anything that is prepared, because that means it's already made and just waiting to be released by the physician or nurse signing off. And anything that is physician verified. You can also sort by date order as well. In order to do this, again, we use the medication list filter and we use the pharmacy ACU template. We only circle main medications. We choose the area, the place of delivery that we're working in, the day ward, so that we don't have to look at work being done outside that. And if we click the 3 dots next to the cost center here, we can choose the consultants that we're interested in. In this screen, you can see that we've chosen a couple of hematologists. In fact, all of them. They're just off screen. You will want to see all medications of all statuses. You may choose to flick planned and on and off as you do your work, depending on how clean the list is. Your time period will be the next 4 days to allow for working ahead of time. And critical to all of this is only viewing administration approved, which has a status of no. In other words, there's a red X, which indicates the treatment has not been signed off. You don't want to see administration that's been approved, because that is work that has been done as far as you're concerned. Select no to the blocked flag. This will mean that most of the old chemotherapy is eliminated from your list, which is probably not your primary concern in terms of managing patient flow. When you have made those modifications, don't forget to refresh the list. And if you want to see the results on full screen, click the blue arrow so that the filter screen collapses and you see all the results. And at that point, again, you can eliminate the columns in the results table to make sure that you can press everything down nicely and make it easy to view.